Dr. Jerri Edwards is an internationally recognized expert who has studied how cognitive abilities can be maintained and even enhanced with advancing age for more than 30 years. Ultimately, the goal of Dr. Edwards' research is to extend the independence of older adults to improve their quality of life. She's particularly interested in how cognitive interventions, often referred to as brain fitness programs or brain games, help older adults to avoid or at least delay cognitive decline and dementia such as Alzheimer's disease. Dr. Edwards, thanks for being here today.
My pleasure. Thank you for inviting me. Are you ready for me to start? Okay, so I'm going to talk to you today about brain training and specifically about how can dementia be prevented. I'm going to talk about this from a general perspective, and then I believe you can put any questions you have in the chat and Eden will bring them up when I'm finished. Does that sound good, Eden? Okay, and I'll answer any questions when I'm done. So, can dementia be prevented? So I am a professor at the University of South Florida, and I direct the Cognitive Aging Lab, and we try to find ways to improve brain function to promote independence for older adults. Our study we have ongoing right now is the PACS study, and you can check that out at www.pacstudy.org if you're interested. Okay, as an overview, I'm going to talk today about what happens to our cognitive abilities with age. How can we maintain our cognitive abilities? What is cognitive training? How to choose a cognitive training program, and research results of the most studied cognitive training program. Eden, would it be safe to say that everyone here also has interest in Parkinson's disease? Because if so, I can kind of customize it a bit towards that. Okay, great. Okay, so first of all, let's talk about what happens to cognitive abilities with age. So when we talk about cognition, we mean a lot of things besides memory. So memory always comes to mind, but there are many different aspects of our cognition. For example, our verbal abilities, and that includes not only our vocabulary, that is knowing what words mean, but also being able to come up with the right word when we need it at the right time. And that's called verbal fluency. Also mental quickness, so speed of processing, how quickly we can take in and use information is very important. Mental quickness, also called processing speed or speed of processing. Memory you all know about, but there are different aspects of memory. Attention is just paying attention to what's going on around us. So we can't remember anything if we don't first pay attention to it. So our ability to focus our attention and regulate our attention is very important. Related to that are some executive functions, and that includes things like multitasking. So for example, Eden has helped me not have to multitask by managing the chat. No one's great at multitasking, and so if I had to both give this presentation and manage the task, that would be more challenging. But a lot of things we do in everyday life do require us to multitask. Some other examples of executive function are planning, initiating behaviors, problem solving, time management, all those kinds of things. So these are some important aspects of cognition. So what happens to our cognitive abilities with age? Well, some things improve, and that includes our vocabulary. So older adults tend to have a larger vocabulary than younger adults. With life and life experience, our vocabulary expands. Also, verbal skills tend to improve with age. And knowledge. So with age comes wisdom is the adage, but it is true that we have more knowledge with age. For that reason, older adults are often better at trivia, such as Jeopardy. Because vocabulary tends to improve with age, older adults often like to do crossword puzzles because that involves coming up with words, knowing word meaning, and also trivia games like Cash Cab. Has anyone seen Cash Cab or Jeopardy? I would always bet on the older adult to win those abilities unless they're timed, because one thing that declines with age is our mental quickness, that our cognitive speed of processing. And in fact, speed of processing starts to decline as early as age 25. I don't know if anyone on this call is younger than 25. But for the rest of us, we have already begun to slow down with regard to our mental quickness. And I'm over 50, so I have been slowing down now for over 25 years. Now, that happens in normal aging, and this is exacerbated in Parkinson's disease. So one of the primary cognitive changes that happens in Parkinson's is this mental quickness slowing down earlier and more than it would if one did not have Parkinson's disease. Other things that tend to decline with age are executive functions, and executive functions also can be affected by Parkinson's disease, such that you experience more decline in executive function or earlier decline than you would if you didn't have Parkinson's disease. And those executive functions include switching our attention, so multitasking and ignoring distraction. All of those things help us to function in a very demanding environment that requires you to do more than one thing at a time. A good example is driving. So when you're driving down the road, you have to pay attention not only to what's going on in front of you, but also maybe what's going on behind you. And if you had, say, your grandchildren in the back seat, you might be trying to ignore them if they were having a fight, which is ignoring distraction. If you were at an intersection, you might need to switch your attention between what's on your right or what's on your left or what's in front of you. Multitasking is doing anything that requires you to do more than one thing at a time. And it could be as basic as walking down the steps and also talking to somebody. I mean, we could start pretty basic like that, but also more higher action multitasking, doing more than one thing at a time or dividing your attention between tasks. The other thing that tends to decline with age is working memory. So this is not just list learning or remembering items, but it's being able to juggle information. So being able to hold information in your mind while new information is coming in. So an example of working memory is say you're in your house and you are headed to your bedroom to get, I don't know, a pair of scissors from your sewing kit. And on the way there, your spouse says to you, do we have dinner reservations tomorrow? If so, where? And then you answer that. And then you go to your bedroom and you go, why am I here? Because what happened was you had a task in mind, but new information came in. And instead of being able to hold on to that information, that new information kind of wiped your slate clean and you forgot. So working memory is juggling information, and that's what tends to decline with age. Also can be exacerbated with Parkinson's disease. So this is a graph of normal aging. So it shows us how these abilities may decline across age. Now there are individual differences. So the ability marked there in green that tends to decline for all of us and tends to decline the earliest is that mental quickness. So that starts as early as 25, and you can see that green line sloping down the rest of our lives there. Other abilities, you see these improvements up until you're 60, 65, some maybe even until 75, that then can decline. But in general, most cognitive declines are pretty small until we reach about 75 years of age. Again, there's a lot of individual differences. So when we think about cognitive decline, I like to talk about it on kind of a continuum. So we can all expect to and all will experience what we consider to be normal or expected age-related cognitive decline, like that mental slowing that's going to happen to all of us beginning at about 25. Now, if we experience more decline than we would expect, so normally we expect patterns to be like this. So we expect most people to have stable, mostly cognitive abilities in middle adulthood until 75. If a person experiences greater decline than we would expect based on their age and education, they might have what we refer to as mild cognitive impairment. Now, what's interesting about mild cognitive impairment is persons with mild cognitive impairment are at greater risk for dementia, such as Alzheimer's disease. Alzheimer's disease is just the most common form of dementia. There are other causes. However, not everybody who has mild cognitive impairment develops dementia. Some people get better and revert back to what we consider normal. Other people get worse. So we believe that intervening early before dementia is necessary to reverse decline or prevent dementia, and we believe that we can do that. But we got to start early. There are many common treatable causes of cognitive impairment. So it could appear as if you have cognitive impairment or dementia when in reality there's something else going on. Depression, for example, can make it appear as if someone has cognitive impairment. So one of the first things we always want to do when somebody has cognitive difficulties or complaints is to screen them and see if they are depressed, because depression can be treated. Anxiety is also kind of a brain killer. Anxiety is terrible for our brains. So anxiety can cause some cognitive impairment. It can increase your risk for going on to develop dementia. So we need to find healthy ways of treating anxiety. For depression, medications for depression are effective. They're also generally positive for your cognition and your function. However, a lot of the medications available for anxiety are not helpful for your brain in the long run, and in fact can increase your risk for dementia. So we need to find healthy ways to treat our anxiety. Some suggestions are mindfulness-based meditation. My favorite meditative approach is a Christian spiritual approach. It's called Lectio, Lectio 365. I would also recommend a program called Headspace for mindfulness meditation. Headspace is available on Netflix. So if you have a Netflix subscription, you can try out Headspace. You can also buy Headspace as an app. Medications. So the more medications we are on and the older we are, those two things can interact and cause problems with our cognitive impairment. So suggestions are specifically if cognitive difficulties arise shortly after beginning a new medication, to have that medication examined, maybe. Ask your physician if it could be causing you to be brain foggy. Another specific suggestion would be have one pharmacist who is very well trained, maybe even a specialty pharmacist in the case of Parkinson's, who knows every medication you're on, who does a review of them to see if there could be some contraindications of taking those medications together. Same thing for supplements. also having a professional, and I'm sure Eden probably knows some resources for you there, to review both the medications prescribed and supplements that you take to see if they could be causing cognitive issues. Other causes of cognitive issues can be vitamin B or D deficiencies. And if you find out you have those deficiencies and treat them, if that is the cause, it can reverse that. Or also thyroid problems. So everyone who's an adult should be having their thyroid checked, their vitamin B levels and D levels checked. Ask your physician to do it if they are not, and make sure that those things are where they should be. So for any of these causes of reversible cognitive decline, you should seek both screening and treatment. So what is cognitive training? So interestingly, in 2017, the National Academies of Sciences, Engineering, and Medicine met to examine all the evidence about what are the best ways to reduce our cognitive decline and to prevent dementia such as Alzheimer's disease. And based on my work, my colleagues' work, many of us together, their conclusions were that cognitive training is one of the top 3 best evidence-based approaches to reduce your risk for cognitive decline and dementia. Now, a lot of things are recommended to improve your brain function. A lot of that evidence, however, is just correlational. It is not from randomized trials. So the best evidence we have is when we do an experiment, a randomized clinical trial to see if truly an approach or a treatment is working to improve cognitive function or reduce risk of dementia. And when the National Academies of Sciences, Engineering, and Medicine compiled all the evidence for all the different approaches that have been suggested or published on, they came up with 3 best ways to do that. One is, of course, we all know, increasing our physical activity. Physical exercise is not only important for your body, but also for your brain. Generally, what's good for your body is good for your brain, and what's good for your brain is good for your body. So we all know we need to participate in physical exercise, even more so if you have Parkinson's disease. So the second evidence-based approach is blood pressure control. So although Alzheimer's disease is the most common form of dementia, the second most common form is vascular dementia. And vascular dementia comes from having many strokes or damage to your brain because of that hypertension or high blood pressure. So maintaining a healthy blood pressure that is the top number under 120 and the bottom number under 90 is important for your brain health and may reduce your risk of cognitive decline and dementia. And the third one was cognitive training. So we started doing cognitive training studies 30 years ago. There is increasing evidence that specific types of cognitive training can reduce your risks for age-related cognitive decline. And to date is the only intervention ever shown in a randomized clinical trial to actually reduce risk of dementia. The evidence for other approaches, such as medications and diet, was not strong. Participating in any kind of general stimulating activities was reviewed, but was not recommended. So even though there's a lot of people talks, the advice about you should learn a musical instrument, or you should do this other thing, these other activities, and this will help you prevent dementia. There's actually no randomized clinical trial evidence that does reduce your risk for dementia or does improve your cognition, or there's very little. However, increasingly, there's more and more evidence that cognitive training can do that. So then what is the difference between cognitively stimulating activities and cognitive training? Well, cognitive stimulating activities on the left are described, my left, I hope it's your left. It's just engaging a range of things that are stimulating, that are thought to maybe promote sustained cognitive and function, such as working on crossword puzzles or playing games like Sudoku, or taking courses, or playing board games, or doing other kinds of social activities. Are these things good? Yes, absolutely. Are these things fun? Yes. Do we like to do things that are fun and we're good at? Yes. However, if you think about the abilities that tend to decline with age, it isn't your verbal skills. It isn't things that you've done most of your life, or things that you're good at. And so what cognitive training does that is different from cognitive stimulation is that it guides you through a set of standard exercises that are designed to target those specific cognitive functions that decline with age. Cognitive training is sometimes called brain training or brain fitness. I would say that the most effective cognitive training programs are computerized. They're also what I call process-based. So process-based means it's targeting a very specific, very basic cognitive ability, such as mental quickness. So since we all experience decline in speed of processing with age, and we all experience that pretty early, we should all be working on improving our mental quickness, and brain training is the way to do that. Also, you can do working memory cognitive training to improve that juggling of information. Unlike just activities that can be fun, these are exercises. So these are things that are challenging and difficult to move our brain to be better. So there are randomized trials of both cognition, of cognitive stimulation, and comparing it to cognitive training. And generally, I'm sorry, my slides are getting away from me here. So generally what, okay, it doesn't want me to show you this slide. Generally what those trials have shown is that cognitive training can produce immediate improvements in cognition, whereas things like learning a foreign language do not show immediate improvements in cognition, or learning to play piano does not show immediate improvements in cognition per se. So cognitive stimulation is probably more effective than, I apologize, cognitive training, very targeted, difficult exercises are probably more effective. So in summary, cognitive stimulation includes things like social engagement, traveling, leisure activities. So these things may help prevent decline. They may help maintain your abilities, but evidence from randomized clinical trials that these are going to improve your abilities or reverse decline or prevent dementia is not existing. To improve your abilities, to reverse declines, to reduce your risk of dementia, I would suggest that you do computerized brain fitness or computerized cognitive training programs. So, cognitive training. What do you need to look for in a cognitive training program? There are many different abilities that need to be improved with age. As we mentioned before, it's the ones that decline. So first of all, we should be working on improving our mental quickness, our cognitive speed of processing, our processing speed. We need to work on cognitive exercises that make us switch our attention between multiple tasks. If it makes us switch very rapidly, even better. We need to work on exercises that force us to ignore distraction. So increasingly, I notice with age, you have a harder time hearing things in noise. So this is a cognitive issue. So it can be your hearing, yes, but it's also a cognitive ability to ignore background noise and focus on the signal, what the person who is speaking is saying to you that you want to hear. Multitasking. A good cognitive training program should make us do more than one thing at a time. and also working memory. A good cognitive training program should have exercises that help us to juggle multiple bits of information, not just memorizing, learning the list. You can practice that if you want. I mean, there have been people who've memorized the phone book, but that's not actually the ability that we need to work on with age. It's juggling all that information. It's keeping information while learning new information. So how should you choose a cognitive training program? Well, one, you need to ask yourself, what does it do? Is it working on those abilities that we need to work on with age? It has to be challenging. It should also be adapted. That means as you get better, it gets harder. If you're having a crappy day and you're tired and you're not with it, it should be easier. So on a trial by trial basis, it should be adapting to where you are and how you are doing. So it's always challenging. You're never going to be able to master it if it's right, because your brain to get better and move forward needs to be challenged. It needs to be difficult. And for that reason, it's probably going to be fatiguing too. So you also want to ask, what evidence supports this? Now, as I mentioned before, you want to make sure that you're looking at randomized clinical trials of the specific brain training program. So just because one brain training program was shown in a randomized clinical trial to reduce dementia risk, that was a study my colleagues and I published, doesn't mean another brain training program is going to have the same effect. You want to ask who was in that study. What were the results? And how do the results transfer to real world abilities? So we know that we can do a cognitive training program, a brain training program, and we can improve pretty much anyone's performance on any task they're working on. That's very well established. What's more important is, if we do that, is it making a difference in their everyday life? So we want to make sure that those exercises are having an effect on everyday outcomes. So you want to ask, what is going to be improved from this brain training program besides the cognitive ability that's targeted or the exercise I'm working on? So now I'm going to talk about research evidence from the best studied cognitive training program, which from my perspective, what I'm an expert in is the cognitive speed of processing training program. Cognitive speed of processing training is now available as an exercise in the Brain HQ program. It is available on brainhq.com. We continue in my lab to study specific brain training exercises to see which ones are most effective, to see exactly what the effects are. And there have been to date more than 18 different randomized trials showing that this specific kind of cognitive training or brain training improves brain function. It also improves our attention and mental quickness or speed of processing. We found in these studies that the specific brain training program enhances everyday function, driving outcomes, well-being. We've also noted that this specific brain training program reduces risk of dementia, including Alzheimer's disease. So some results from this program. Early on, we found that older adults who were randomized to this cognitive speed of processing training experienced improved driving outcomes. And this was relative to a driving simulator course and a driver instructor course. So older adults in our study who were randomized to do the cognitive speed of processing brain training had faster reaction times in a driving simulator. They showed improved driving safety on road. So they were 40% less likely to have a dangerous driving maneuver. That was defined as the driver instructor having to take control of the vehicle to avoid a crash, or another car to have to change their trajectory to avoid a crash. We also followed the study participants' driving records for 5 years. I almost said 50 years, Lord have mercy. For 5 years, and we found that the Participants who were randomized to this specific brain training program were 50% less likely to have an at-fault crash, as noted by their state records over the next 5 years. We've also found that older adults who worked on the brain training program show prolonged driving mobility. They're less likely to quit driving over the next 3 years. Other results. So in several studies now, let's see, I have 6 listed at the bottom. We have found that this specific kind of brain training, speed of processing training, improves everyday function. We tend to talk about everyday functional abilities in gerontology as instrumental activities of daily living, or also called IADLs. This includes the ability to manage your finances, to do your grocery shopping, to use your smartphone, to manage your medications, to prepare meals. These are all things that help us maintain our independence in our own homes. And what we found is that computerized speed of processing training makes people faster at these everyday tasks that help them maintain their independence, faster and more accurate. One of our largest and longest studies is called the ACTIVE study. And this study was started actually when I was in graduate school about 1996. And it was done across northeastern locations in the United States. It involved almost 3,000 older adults. And what we found in the ACTIVE study was that older adults who were randomized to the specific computerized speed of processing brain training program actually showed improvement in their IADLs, their everyday functional abilities, from baseline to about 2 years. And then thereafter, they showed less decline. So that group on this slide is the yellow group. So in the ACTIVE study, we randomized older adults to do 3 different kinds of cognitive training. The yellow line is the computerized speed of processing training program. The purplish grayish line is the memory training program. They learned how to remember information, like list of information. The green line is the reasoning training program. They practiced recognizing patterns to solve problems, almost kind of like an SAT analytical prep or LSAT analytical prep, recognizing patterns and then using that pattern to solve a puzzle or a problem. So what we found was that yellow group, that computerized cognitive speed of processing training program, they showed the least amount of functional decline over the next 10 years. All the groups were better than the red group, the control group, who didn't do any kind of cognitive training, but the computerized brain training showed the least decline. Results, health and well-being. So we've also found that computerized brain training can improve health-related quality of life, protects against declines in health-related quality of life across 2 to 5 years. Older adults who've been randomized to the cognitive speed of processing training program report less depression. It seems to protect against developing depression. And they also report feeling like they have more control over their lives. So there are also health and well-being benefits of computerized cognitive speed of processing. Of course, our most famous results are that we found in the ACTIVE study that those who were randomized to the speed of processing training program, so that was the yellow line a couple slides back, were actually significantly less likely to show signs of dementia 10 years later. So the blue bar that says 33% shows us that those who are randomized to the speed of processing brain training program were 33% less likely to show signs of dementia 10 years later. Now, this is a funny thing about randomized clinical trials. So if you were randomized, we analyze you as if you did the treatment or as if you took the drug in a drug study, regardless if you did or not. So we also looked at a dose response kind of effect. And that is, if we just look at the people who actually did the training, for those people, what was their reduced risk? And those persons were 48% less likely than controls to show signs of dementia 10 years later. We also had the memory training group and the reasoning training group, but neither of them showed significant effects on reducing risk of dementia at 10 years relative to the control group. So in summary, we have found several benefits of this specific cognitive training program. Including improved cognitive quickness and attention, improved brain function, improved everyday functional performance, maintained driving safety, maintained health-related quality of life, improved sense of control, reduced risk of depression, and most importantly, reduced risk of dementia. Now, we have done I did one small study in Parkinson's disease with this brain training program, and we did find some improvements in mental quickness immediately post-training in that study. Some other people have followed up. I have read a recent meta-analysis that suggests that cognitive training can also be effective in Parkinson's disease. So for those of you who don't have Parkinson's disease, we do have a study right now going on called PACT, Preventing Alzheimer's with Cognitive Training. That is our study website. Unfortunately, it isn't for persons with Parkinson's, but if you know or have loved ones or caregivers who would be interested in joining, we have sites at Duke University, Clemson University, University of South Florida, in Lakeland, Sarasota, St. Pete, Tampa, as well as, I'm forgetting someone, Duke, Clemson, University of Florida in Gainesville and Jacksonville, University of North Florida. And we would love for you to refer friends and families to our study. We believe it's never too late to change your mind. I would say there is preliminary evidence that also applies in Parkinson's disease, that it's not too late. Work on effective brain training programs, and I will answer questions.
Thank you, Dr. Edwards. I do have some questions. One of the first questions, because you talked about that thyroid can affect dementia. So one of the questions was, did you mean hypothyroid or hyperthyroidism?
I think yes. A thyroid dysfunction can cause you to have cognitive difficulties, but when treated, those cognitive difficulties should be reversed.
So it doesn't really matter though, hyper or hypo.
I don't think so, no. I think when your thyroid's jacked up, it jacks up everything, if I may use layperson terms.
Thanks. Someone asked if you could please explain neuroplasticity.
Okay, so neuroplasticity is actually a term that means your cognition can change and your brain can change. So pretty much everything we do affects our brain, everything. The more we do things that are new and challenging, the more likely we are to make new connections, new synapses in our brain. And I believe that is what most people mean when they refer to neuroplasticity. Cognitive training works because of neuroplasticity.
And we have a lot of questions about computerized brain training that you recommend, training available online. What are some of the computer-generated cognitive training programs? Are there websites?
Yeah,
a lot of questions.
Yeah, I usually show those slides. So let me pull one up and share it. So the brain training program that I'm summarizing the results from here for you today is now a part of what's called Brain HQ. And Brain HQ is a program that you can get now online. You can try out at least some exercises for free, so you can try before you buy. I do not have any financial interest in this program, just to be sure, to be clear about that. But this brain training program that I have researched for many years is a part of it. It is referred to in that Brain HQ program as the double decision exercise. So I would definitely recommend the double decision exercise of Brain HQ. Let me see if I can find a slide that to share that. Yeah, so can I share my screen again?
Yeah.
All right. Okay, so the Brain HQ program is from Posit Science. I think they phased out the AAA Drive Sharp program, but that Brain HQ, that's their logo, and it's brainhq.com. And that is the best evidence-based approach, in my opinion. There are other brain training programs. I'm not as familiar with the other programs. I can say that none of them have yet shown reduced risk of dementia in a clinical trial.
Someone said, since you're speaking about it, how many types of dementia or reasons for dementia are there? Because someone said that they'd heard about like 300.
Oh, wow, that's interesting.
Mhm.
You know, it could be. So funny, I'm not actually an expert on dementia. I'm more an expert on healthy aging. And then that led to us looking at interventions to promote healthy cognitive aging. And then it just so happens that our intervention was shown to reduce risk of dementia. And then that became more of my world. But my research is more about reducing risk or preventing dementia. Um, there are many types and causes of dementia. It is definitely possible that there could be many that we don't even know or understand, but they all kind of manifest similarly to us when we're looking at a person and interacting with them and the kinds of behaviors they might show.
Is there a specific program for driving? So you had mentioned the Brain HQ. Is that something good for driving?
Yes, so the double decision exercise in Brain HQ is the one that has shown to improve several driving outcomes and also reduce dementia, and it has also been studied in Parkinson's disease. So I would recommend it for sure. I will say that it's more for very early phases. It is not appropriate for people who already have signs of dementia or have already been diagnosed with dementia. So it's very important to start brain training early. I often tell, if somebody comes to me and says my parent or loved one has dementia, I often say you should start brain training now, because it's about early, and it's about early intervention and prevention, in my opinion.
We did have some questions on the PACT study. Someone asked if you are recruiting people with Alzheimer's to participate in this study, or are you looking for healthy subjects? One person asked if you could do this in Southern California. It seems like it's more North Carolina with Duke, South Carolina, Clemson, and then in Florida. Is that correct?
Right. So the Preventing Alzheimer's with Cognitive Training study is for healthy adults 65 and older. I do highly recommend that you get involved in a clinical trial. The way to do that is a number of ways. I'm trying to think of the best way. Research match is one way. Trial match is another way. The Alzheimer's Association does have, I think Alzheimer's Association has a way through trial match. Research match, Also, I mean, you can find a specific study for you and in your area by using a website called clinicaltrials.gov. So pretty much all clinical trials, especially in the United States, especially if funded by our government, the National Institutes of Health, are registered in clinicaltrials.gov. And you can find out if it is for dementia. Also, if you're specifically looking for a trial for someone with dementia, I would recommend the Alzheimer's Association trial match. But if you want something else, like for Parkinson's disease in particular, I would go to clinicaltrials.gov, and you should be able to search by Parkinson's disease and also by your location to find a trial. So the only way we're going to find a cure for any of these things is by people volunteering for research. And the first person to be cured of Alzheimer's and the first person to be cured of Parkinson's will be somebody in a clinical trial. So please join, help us fight these diseases by being a part, by volunteering for research.
Question about luminosity. I just looked it up. That seems to be more of a brain stimulation as opposed to brain training. Is that correct?
I would not say that. I would call Lumosity a brain training program. It does have tasks that are very similar to double decision exercise. Most of the evidence last I knew about on Lumosity was more in specific populations, in younger populations. It seems like they had done some studies in chemobrain. I've read one study published with older adults. Like other cognitive training programs, it'll improve the abilities you practice in training. I don't know the evidence about it transferring to other things. None other than the Brain HQ double decision exercise has been shown to reduce risk of dementia.
Can you talk about how stroke and TIA can affect all of this?
So stroke and TIA are cardiovascular events. So the second most common form of dementia is vascular dementia. So when we went to that slide about the 3 ways to reduce your risk of dementia. Number 1, physical exercise. Number 2, blood pressure control. Those are directly going to affect your risk of a stroke, your risk of a TIA, which then directly reduces your risk for vascular dementia. Did I answer the question?
And then somebody did ask, they don't see on Headspace site where Netflix subscribers log in. Do we have to go there through the Netflix site?
On Netflix, you used to be able to watch Headspace videos. So literally like on your TV, Netflix, last I knew there were Headspace videos that you could watch for free with your Netflix subscription. If they're not there anymore, then you should be able to go to headspace.com or download the Headspace app on your smartphone.
Someone asked, in the study of processing speed, how long did the subjects do the training when they showed improvement?
So initially, we found that only 10 hours of training exercises were required to show improvement. Those 10 hours were done like one-on-one with a trainer. And actually, that was my job in graduate school. I was a trainer. So I literally set up the exercises for the older adults we worked with and adjusted them within that session, was right there with them. So in about 2006, we moved that training program into what is now the Brain HQ program that was marketed by Posit Science. And we found the great thing is they made it available online. They made it available so you don't need me to train you or anyone else. You can do it on your own, but when you do it on your own, it seems to be more like maybe 20 hours of that specific double decision exercise. So there are many different exercises in the Brain HQ program. Their kind of approach is to put all of them out there. And if you subscribe, they have an algorithm that tries to narrow down what it is that you need to work on the most. And they will guide you through those exercises. You can also just choose to do double decision since it has the most evidence. So if you know yourself and you know you're not going to be devoted to this more than about 20 hours, then you could just subscribe for 3 months, do 20 hours of double decision, and you should have some benefit from that.
Someone asked, because you talked about the vascular dementia, is low blood pressure also a dementia risk or just the high blood pressure?
Oh, I'm not positive. Does anyone else know? It's probably, my guess is like your thyroid. Both are probably bad, but I don't know for sure. I would have to look that up. I don't know.
You talked about with the brain stimulation, you talked about the lack of randomized clinical trials. Is that there is a lack of randomized clinical trials, or do the studies exist, but they don't show significant improvement? So
with regards to just doing like cognitive stimulation,
most studies at this point are randomized.
Okay, let me give you some examples. So for a very long time, people have been told, learn a foreign language, that's good for your brain. That came from correlational evidence that bilingual individuals are less likely to experience dementia. So often these kinds of recommendations are from correlational studies where they compare people who have dementia and don't have dementia and see what's different between them, or see the percentage that develops dementia. But that's correlational data. So it could be that someone who's bilingual had a number of other factors in their life that could have affected their dementia risk. Maybe they were wealthier. Maybe they were more educated. So we don't know exactly what it is about that one thing about bilingualism that may have been associated with a lower dementia risk. It could be a third factor that we're not considering, and that's the problem with correlational evidence. So increasingly, we are trying to do randomized clinical trials looking at those things. For example, learning a foreign language. There's been one randomized clinical trial to my knowledge on the effects of learning a foreign language on your cognition. It did not show any immediate benefits. Playing a musical instrument, you can still go to a website and see, go learn a musical instrument. That comes from evidence that musicians may be less likely to have dementia than non-musicians, but the same thing is applying there. So what about it? Is it just learning a musical instrument? Is it devoting your entire life, 30 years, to playing music on a daily basis that made a difference? Is it wealth, education, the situations that you were in that led you to be a musician in the first place? Or maybe your genetic tendencies that made you really good at music that reduced your risk of dementia. We don't know from those correlational studies. So randomized designs of studies of cognitive stimulation, there are some studies. They tend not to be long-term. They tend to be small. There are more randomized clinical trials, but honestly, when we compare them head to head in randomized clinical trials, cognitive training is more effective. Did I answer the question?
Yeah,
okay.
Definitely. But then I also have a question about, because you mentioned for the PAC study, you had to be over 65. Do you know how old the elderly people were in the randomized clinical trials that you were looking at, especially for Brain HQ? Obviously they were over 25.
Most of the studies 65 and older. Our driving studies, we did 55 and older. So with us living longer and with just improvements in health that we have experienced generationally, the age at which cognitive decline starts has been older and older. So in the course of my career, we used to enroll people age 55 and older and find people that had some cognitive decline, but then that started to change, and we don't typically see cognitive decline until, say, 65 or older in an otherwise healthy older adult. So 55 to 65 or older.
And another question. Someone says, it seems like what you're discussing follows the pattern of like, I would do the training and someone else would gather the data. Is there a way that I could monitor my progress from time to time and check up on myself versus somebody else, monitoring me?
So the Brain HQ program, no one's monitoring you personally. There's algorithms that will guide you to exercises based on your performance. It does have ways of showing you how much you've improved. It shows you how many stars you've earned, what levels you've completed. A research study is different. So in a research study, you are being closely monitored and you're being tested in a very systematic fashion. I think maybe that answers the question.
Last question, because we're going to be out of time soon. You talked about like the 20 hours and you said you would still see improvement, but someone said if you stop doing the cognitive training, will you lose any of the improvements gained?
So generally, a concept of neuroplasticity, if you will, is that to continue to experience improvements, you have to continue to do difficult, challenging, novel tasks. If you stop, do you lose? Yes. If you start again, do you gain it back faster? Yes. But in the study results I showed you, although the persons who did what is now the double decision exercise in Brain HQ did only about 20 hours, they were declining later, but that rate of decline was slower. And so that means it's delaying the onset minimally of dementia.
Well, thank you, Dr. Edwards.
Thank you for inviting me.
This has been incredible. We do, as always, encourage everyone to save their chat. If your chat is open, you'll see 3 little dots on the bottom next to a smiley face. If you click on the 3 dots, it'll say more, and you can save your chat. So you can have all the Brain HQ, the other
PacStudy.org.
Yes.
Thank you.
That was also in there. And it was just excellent. As always, we have our tradition here at PMD Alliance, our wave of gratitude. Thank you so much for your time today. This was excellent.
My pleasure. Thank you, Eden.
Have a great day, everybody.
You too.